Hello, everybody. I'm Dr. Narayanan Balakrishnan, and I'm a senior resident in the Department of Ophthalmology in Sri Ramchandra Institute of Higher Education and Research. I'm also an associate consultant in the glaucoma services in our department. Here I am to talk about a few frequently asked questions in glaucoma. This is a continuation of my previous video where I tried to answer some of the commonly asked questions by patients with regard to glaucoma and its progression. The most common question patients ask is, will I go blind if I have glaucoma? It is very important to understand the nature of glaucoma as a disease. Glaucoma, unfortunately, though not curable, its progression can definitely be halted. Glaucoma is a group of nerve disorders which affect the optic nerve, thereby reducing your peripheral vision and at the same time can affect your quality of life. So there are some risk factors which determine the progression of glaucoma. The commonest risk factor, which is the only treatable risk factor, is intraocular pressure. The others being age, central corneal thickness, that is the thickness of the cornea, visual fields, which are damaged as a result of the nerve damage, and of course, the lifestyle of the patient. So now, if we have to halt the progression of glaucoma, the only modifiable risk factor, like I mentioned earlier, is intraocular pressures. And we always start by medicating the patient to reduce pressures. There may be certain additional procedures done, like lasers, and eventually even surgery to reduce pressure. So in this process, how do we determine the entire progression and halt the progression of this disease? It can be done purely by modifying the intraocular pressure can be challenging many times if the patients are not compliant with their medication. So if the patients are diligent in using medications, review adequately, and at the same time follow the courses as mentioned by the doctors, then many a time the progression of glaucoma can be halted and blindness may not result. Because central vision is affected last in glaucoma, many patients do not realize that they are losing their vision and hence may not take their treatment very seriously. But to realize that the peripheral vision starts constricting slowly, it is important that patients are very diligent with their medications, and as doctors, we stress on compliance and adherence to medication. The next question many patients ask me is there any food that I can eat that can reverse my glaucoma? Unfortunately, there has not been any therapy with food that can help you reverse glaucoma. However, there has been mindful meditation, which has been looked at very seriously to halt the progression of glaucoma, and adequate breathing, which can improve the ocular perfusion, and avoiding exercises which include headstanding, Shirshasana, lifting heavy weights, breath holding, all of that can halt the progression of glaucoma. So you need to avoid these. And of course, mindful meditation is known to play a very important part in halting the progression of glaucoma. However, there has not been any active evidence regarding the use of any food that can prevent or reduce the chances of progression of glaucoma. The next thing is, how often do I need to get my visual field tests done? It purely depends on the state of your disease and, more importantly, how your eyes are when you are diagnosed. So when a patient is diagnosed with glaucoma, the recommendation is that all patients get at least 6 to 7 visual fields in the first 2 years, establishing a good baseline, and so that we do not miss very rapid progression. This is what we call as tolerable rates of progression. These are rates that the human eye can normally tolerate without going blind over a period of time. So if we are able to take these many number of fields to actually look at how much progression that is happening and to establish a good baseline, we can monitor and halt the progression of the disease over a course of time. But then, that apart, on an average, every patient who is on follow-up has to get at least one visual field every 6 months to 1 year, depending on, like I said, where your progression is. However, if you are a suspect where there is no established glaucoma, you're not being treated for the disease, but you are being closely watched because you have certain risk factors for the progression or for the development of glaucoma, you will require visual fields at least once a year or at least once in 18 months. And even once you're a suspect, you have to be on the radar and regularly follow up with your doctor to prevent the progression of your disease to actually developing glaucoma, and to look for any risk factors or signs that may newly develop and need adequate treatment. So one patient asked me, and I think I've had a few other patients who also do the same, asked me that in an eye checkup, they told me that I have high pressures. Do I have glaucoma? So intraocular pressure, like I mentioned at the beginning of the talk, is a very important risk factor for the progression and development of glaucoma, but it does not equate to having glaucoma. So your intraocular pressure may be raised due to multiple factors. Okay, sometimes even if you just hold your breath for very long or squeeze your eyes too hard or too tight, you may have high pressures. So that does not necessarily mean you have glaucoma. You have to have a comprehensive evaluation of all the necessary parameters done to actually establish if you have the disease. These include a baseline visual field test, an intraocular pressure check, a check that is done if required through the day, an evaluation of your central corneal thickness, a good evaluation of your optic nerve to establish any kind of changes that may have occurred. And of course, getting a detailed history and other risk factors that may cause an increase in glaucoma. Some drugs like steroids may by themselves iatrogenically cause a rise in intraocular pressure, and those conditions are usually, the intraocular pressure is reversible even before you develop glaucoma. So there are multiple other conditions and other diseases, drugs that may cause a rise in intraocular pressure. So it doesn't necessarily have to be that you have developed glaucoma. With high intraocular pressure and you not having any nerve changes, you're still labeled as ocular hypertension. Now, ocular hypertension needs to be treated, but a marginal rise in pressure, if there are no other risk factors, can be observed. So it is very important to get a detailed and thorough examination and to be very close in the follow-up radar. And it doesn't necessarily mean that you have glaucoma, but you have to be under close watch to make sure that you do not develop the disease. A couple of other patients in my previous video had asked me about saying, my vision is good. Do I need to continue my drops? I do not feel any change. Do you think I need to always use my medication? It's been COVID time and not being able to follow up with my doctor. You have to realize that glaucoma as a disease affects peripheral vision. And because central vision is affected last, many a time patients do not realize that their visual fields are reducing. So it is very important that patients, or if once prescribed medications, till the doctor asks them not to continue the medication or ask them to stop the medication, they need to continue the usage of their medications diligently and exactly point by point, like they've been asked to use it. And if they feel that there is any side effect with the medication, or they feel they're not comfortable with the medication, they need to report back to their doctor, and only the doctor should stop the medication. So that apart, there is no actual benefit that you can visually realize, but you have to realize that you are doing the greatest favor to your eye by continuing using those medications once or twice a day, just by like how the doctor has asked you. So these are some questions that I thought I should address, because there were some feedbacks which we had gotten from the last time. I would also like to, if you feel free to comment on these videos and subscribe to our YouTube channel. And if you do have any questions, I'd be happy to take them and address them in a detailed manner in my next video. Please continue to get your eye checked. The world is bright, and save your sight. Thank you.